Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is an introduction to non-animal methods, and it is presented by Dr. Megan LaFollette. Megan is the executive director at the 3Rs Collaborative, where she advances better science for both people and animals. She received her PhD and Master of Science in Animal Behavior and Welfare from Purdue University. She's an expert in advancing the implementation of practical, impactful, and evidence-based 3Rs techniques.
Today's learning objectives include defining the 3Rs of animal research, identifying several types of replacements, as well as their advantages and disadvantages, and then understanding how various personnel can forward the implementation of replacements. And they're generally considered, these 3Rs, a guiding principle for animal research. They're present in many policies, regulations, and guidelines around the world, including those in North America and the United States, such as the Guide for Animal Research, APHIS, ILAR, USDA, AVMA, up in Canada, the CCAC. Many different documents reference the 3Rs as an important part of animal research. And this is really essential because, as I'm sure many of us know, the use of animals for scientific purposes can certainly be controversial. There's concerns about animal sentience, about the pain, about the value, and there's many different concerns. And so the 3Rs can help to some degree, if they're properly applied, alleviate some of these concerns. Other concerns are just the animals kind of experiencing pain and distress, and just the ethical justification of these harms. The final category is training-focused replacements. This is a bit of a different class, but it's about using physical models or virtual techniques, so whether that's videos or artificial reality, to replace the need for live animals in training. At least for a portion of the training, sometimes we're able to completely replace them altogether, and so they're not needed at all, especially when we're maybe training human doctors or human nurses, so they're never going to be able to work with animals. And sometimes if, say, we're training people in an institution how to do a particular procedure on animals in their experiments, we're able to replace that early training, and then we still may want them to practice that technique on a live animal later. But a common example of this is, we used to use, and sometimes still do, use pigs to train human medical professionals. And instead, we can use these high-fidelity human mannequins that look like humans, that respond like humans, that are really complex and really mimic what a human body looks like.
And lastly, I invite everyone to review our content offerings regularly, as we are continually adding new courses and webinars that may be of interest to you all.